So we talked about the who and the how to launch a school-based health center, and it provided an overview on how to start a school-based health center on campus, which included who to involve in the school-based health center planning committee. So if you missed any of these webinars, don't worry. Our team will share those links at the end of this webinar. So today we're going to continue this journey with Sang and Amy from the California School-Based Health Alliance, and they're going to provide an overview on how to engage schools, families, and the community when starting a school-based health center on campus. So Sang and Amy, it's all yours.
Okay, great. Let me put this in slide or presentation mode and then we'll get going. Okay, there it is. Okay, good afternoon, everyone. Happy Lunar New Year for those who celebrated. I don't know if you can see my Chinese shirt here, but I have it on. I get to wear it, a few days out of the year. Again, thank you for being with us today. This is the third of 5 installments that we're doing with the San Bernardino County Superintendent of Schools team, and we're just so delighted to partner with them. Speaking of partnership, so today we're going to be talking about how we can engage school, family, and our community partners in advancing school-based healthcare. I'll say a little bit more about the title in a second, but let me go ahead and have my colleague and I introduce ourselves to you. So Amy?
Hi, everyone. So nice to be here with you. I'm zooming in from Oakland, California, and I'm the Behavioral Health Project Director at the California School-Based Health Alliance. And I've been at this job for less than a year. Prior to that, I was overseeing school-based health centers in Alameda County, Oakland, San Leandro, and San Lorenzo. And so I have been able to bring some of that on the ground experience working in schools and knowing some of the challenges and benefits that come with trying to do this really important work. Back to you, Sang.
Yeah, no, we're so happy to have Amy on board because, like she said, she brings that ground level experience. And even today, she'll be bringing that where I think I come more from a conceptual perspective. Again, my name is Sang, and I actually work as a consultant to the California School-Based Health Alliance, although I was actually a staff member more than 10 years ago. I think at the time when I started in 2005 or 6, I think I was like employee number 7. We were calling ourselves by employee number, except that we weren't paid the kind of dollars that Google was paying their employees when they call themselves by the number of when they entered the organization. So I've been doing school-based healthcare work for more than 15 years now, and the first 6 or 7 years was really statewide, helping about 5 counties in Southern California to do this work. But really, prior to last year, I spent 10 years working for the Los Angeles Trust for Children's Health. Some of you know the organization. It's a nonprofit organization that actually works to advance school-based healthcare in LA Unified School District, which was at the time and still is the 2nd largest school district in the nation, the largest in California. And so a lot of my experience actually comes from spending those many years with LA Unified and really learning so much about school-based healthcare because they have over 50 school-based health centers. And so now I'm back with the Alliance, but really in a more of a consulting role and really supporting the Inland Empire. And I live in the Inland Empire, even though I'm particularly not there today, but we're so excited to spend time and I think our attention and resources in the region because we know that it's so needed. And this is, and one way we're investing is really partnering with the Superintendent Office of Schools to really hold this webinar series. I mentioned earlier about the organization we work for. We are a statewide nonprofit organization specifically dedicated to advancing school-based healthcare. California, with about 300 school-based health centers, unfortunately, is one of the few states without an Office of School-Based Healthcare, like many other states. We do have sort of a program in school-based healthcare, but it's staffed by like one person, and even that took a long time. And so while we're waiting for our state legislators to really make true investments, the Alliance is really playing that role, and we've been playing that role for about 20 years now. providing support to our existing school-based health centers and really providing support and technical assistance for those who want to enter into this field of really helping our students, be well and really be able to be in school and in their seats and learn and what have you. And so we focus on technical assistance, we focus on advocacy efforts, and a lot of the work that we do is with partners. And so I think this is a good topic for all of us to really come together and talk about, and you'll get more resources about our organization. Alex mentioned this is the third of the 5 series webinar that we're doing with the Office of SBCSS. I still stumble over that acronym. And we hope that, you'll either go back and look at some of the past webinars or, some of the future things, but we also know that this is really the starting point, and we hope that, we are going to continue this partnership for a long time to really see school-based health centers come to fruition in the next, 3 to 5 years in the region. For our objectives today, it's really broken into 3 areas. We're going to talk about engagement with the school. Some of you are from the school community, some of you are not, but even if you are from the school community, what does that look like, as a school district or school person? And we're also going to hopefully have you have you be able to describe strategies to engage with parents. And I put here parents/family, depending on, who you're able to really get involved. And then lastly, really think about strategies to engage with community partners, because in the work of school-based healthcare, it's all about bringing partners together to the school to be able to provide, healthcare services, promotion, education to our students. And we don't do that alone. We always say, schools are in the business of education while our community partners are in their respective field of healthcare or health promotion or what have you. But how do we bridge those two together? And that's really what engagement is about. The last thing I'll say before I turn over to Amy is that we know there are, about a dozen school-based health centers in the region right now. Some of you may be already operating school-based health centers. Some of you are thinking about it. Some of you actually have plans in place around trying to put together your planning committee and bringing and really, hopefully thinking about bringing a brick and mortar or mobile unit to your site. Throughout this webinar, the strategies that we're going to be talking about, some of them are perhaps a little bit more applicable to sites that actually already have school-based health centers, and some perhaps are, broader in terms of the, where people are in the planning phases. So I just want to make that caveat because, some of this you might think, that might not really be appropriate for my site because we don't have a school-based health center yet. But that's kind of the idea, right? Is that all of this work is rooted in partnerships and cultivating relationships and really engaging with the people and bring people together at the table. But we also know that it's a diverse stakeholder group, and so today we're really going to try to break that into these 3 subsections. Okay, I'm going to be quiet now and turn over to Amy. Thank you.
Great, thank you, Sang. So yes, as Sang was mentioning, this engagement piece, this integration piece is just a really, really critical piece of the work of school-based health centers. Sometimes we can focus on the services that are going to happen inside the school-based health center, if it's medical services, behavioral health, youth development, all the things we want to incorporate into the school-based health center. And an important thing that we always have to remember is it's not just what's happening inside the walls of the school-based health center, it's what we're doing to reach out and to engage with the school partners, the families, the community partners as well. So starting with talking about the school engagement. We at CSHA have had the privilege of working in lots of different communities with lots of different school-based health centers, school districts, and schools. And we've really seen that our most successful school-based health centers are those who really have strong and intentional and ongoing integration with their school partners. And so, I wanted to just pose this question initially: why is school integration so important? And I wanted to just ask you to take a moment to think about that and maybe throw some ideas into the chat just so we can start just delving a little bit more deeply. So I'm going to give you a moment to just think about why do you think school integration is so important for this conversation about school-based health centers. Don't be shy.
So we have some answers in the chat: to improve overall health and well-being, bridging the gaps, improving access to resources for families in the community, to remove this attendance issues due to health problems. Karen Scott wrote, I represent children prenatal through age 5, and it's important that school-based health is considered a strategy that begins before school attendance. We have also provide care to those who have no access, provide an opportunity to expand the resources for students and families.
Great. These are all wonderful. Thank you all so much. Appreciate that. Well, I'll keep going, but feel free to keep putting things in the chat. So Sang, if you want to go to the next slide. So a couple of things I'll just mention about the why of school integration. First, it's just really increasing the impact. Your school-based health centers are most effective and sustainable when they're really well integrated. This is kind of the foundation of the close partnerships with the school personnel. It leads to a deeper understanding of the work that happens by the school community, and this is really important. It leads to effective referrals to the health center, which leads to more utilization, and this is just all part of sort of moving towards increasing that student impact. It also ensures sustainability. Obviously, the high utilization by students means that there's more opportunities for billable services. There's going to be things that are, services that are not billable, and then there are things that are billable that really help to make sure that services can be sustained. Finding different avenues for billing from different sources is really part of the sustainability piece. And so as more of the school community, and particularly like the administration, really sees the value and sees the impact on students, there's a lot more commitment to helping to ensure that there are sustainable and continuous funding streams. Because when different funding streams ebb and flow, you really want your services not to fluctuate in that same way. You want to be able to solidify that commitment from the school community that this is really an important service to the students. The next one is wellness equals increased academic success for students. So I think really helping folks make that connection, that when our young people, when our children feel well, when they have some of their needs met, their behavioral health needs met, their other issues that are happening, they're more able to be present and engaged to reach the academic outcomes that we want for them. We know that school-based health centers decrease absenteeism. We know they better support the student attendance. They lead to students feeling more school connectedness, which really is going to lead to more focused and engaged students who are ready to learn. And then finally, the school-based health centers really support a positive school culture. School-based health centers can participate and lead in the overall culture of wellness and positive climate. But of course, that requires that integration and that partnership with the school. So, I just want to mention, though, that all of this doesn't happen all at once or at one time or right as you launch. Like, this is very much something that is ongoing. And it's a collaborative process between the school-based health center and the school staff, and that is a two-way street involving a commitment on both sides to really be making sure that these two systems of health and education aren't siloed, that they're working collaboratively, and there's good communication to ensure that these programs can really thrive. We want to see this as a really ongoing part of the school-based health center work. It is not a one-time thing, and just acknowledging it's hard work. and that it's multi-year work, right? That's going to grow over time. Next slide. So this next slide is just about school community buy-in. It is really, really important that the school community embrace the school-based health center as a really valuable part of what the school can offer. And this, of course, also takes time and effort to really grow that buy-in and build those strong relationships. And these can be really individual relationships, right? Like the more that teachers feel connected and welcomed and understand what's happening, the more likely they are to encourage their students to utilize it. And it really is part of building visibility as well as building trust on campus. One of the things that I used to come across when I was running school-based health centers is sometimes teachers or other staff, they wouldn't even know that there was a school-based health center on their campus. And so I would say like, oh, did you know? Do you refer? And they would, just have kind of a vague understanding. And that's always a challenge because, schools have a lot of turnover. They have new teachers coming all the time. And so this strategy of building buy-in is ongoing so that everyone on the campus really is engaged and understands what the services are that can be provided and are aware and know the ways to engage and to refer students. So there's lots of creative ways that I've seen this be done on school campuses through, hosting teacher breakfasts in the school-based health center, holding tours, doing special events. So everyone on the campus, all of the staff have the opportunity to really get their eyes and ears on what's happening in the school-based health centers. Often providing some wellness support to the teachers and other school staff can be a really helpful way to increase that buy-in and build those strong relationships, find those wellness champions. So I encourage you to think about what buy-in would look like at your school sites, who are or could be the school-based health center champions outside of the center. What support do you have from administrators, from teachers, from other school staff, and thinking about the ways to nurture that. Next slide. So these are the principles of integration that CSHA has really developed over our years of working with school-based health centers. And I'm just going to go through them quickly. But, the first is just developing mutually supportive policies and procedures that advance school health and learning, adopting school-wide strategies and frameworks that support healthy behavior and academics to help students with the highest need, establishing collaborative systems and structures to plan programs and direct resources to students, implementing school and health programs and services that support the student goals and that really target student populations of concern, participating in school and health program leadership, decision-making, advocacy. As much as school-based health centers can be at the table when things are happening at the school site is really pivotal for that integration. Utilizing education and health data to drive policy and program development, and engaging in joint resource development. So I know that was kind of a lot of words, but we'll go to the next slide and break it down just a little bit. So this is one of those integration principles that I was mentioning. This one is about establishing collaborative systems and structures to plan programs and direct resources. So, this is really where school administrators and school-based health center staff come together to really develop some policies or processes that are going to support the school community as well as the functioning of the school-based health center. So the goal here is developing a mutually supportive program. In this case, the sample that I'm proposing is around co-developing a plan for how appointments are going to happen, drop-in appointments, appointment scheduling, what's the policy going to be, and what are the ways that we're going to work out some of the potential challenges. And, this is a specific example, but it's actually one that I've seen be a point of tension on lots and lots of school campuses, because students are often coming out of their academic classes to get one of their health needs met, and then they're going back to class. And so that can be a disruption. That can bring up feelings from the teachers about, like, why are you taking this student out of class? They really need to be here. And so, like, having a really well thought out plan of how that's going to happen to reduce that tension is important. So bringing folks together to have that conversation to find the best solution. That sample process would be that once decided, all the school-based health center staff, all the school staff are trained on what that policy is, given those protocols. In this case, everyone's going to have a laminated pass for students to go back and forth, but just really making sure that it's kind of crystal clear how things are going to operate. And this really will reach that anticipated outcome of decreasing disruption to student academic, their program, and increase the utilization. Also, things around confidentiality are really important to lay out in a plan. So teacher might know that there's an appointment for that student, but they're not going to know necessarily what that appointment is for. And it's also protecting the student from, other young people knowing what they're accessing services for. So that's an example of, like, really wanting to translate these integration principles into action. Zane, do you want to go to the next slide?
You know what? Can I chime in for a second, Amy?
Yes.
So I love that you talk about this decreased disruption to students' academic programs. So let me just share two quick examples. San Fernando Teen Clinic up in the San Fernando Valley, they were one of the first 4 school-based health centers in the state, actually. And so they have a beautiful system where the school nurse is actually co-located with the school-based health center. And so as part of what Amy talked about, what is the system or structure in place, they actually have, they develop a system where after students are seen at the school-based health center, they're given the school nurse, because I think she or he is located right at the school-based health center. They came up with a pass back to class where students were given 15 minutes to get back there. And so that way, there's a little bit of leeway, but even something like that, can help, bring kids back to class faster. But there was agreed upon system of, like, okay, if you're going to come to the, school-based health center and you finish your appointment, the student may or may not go back, at the beginning of a certain class, but at least they came up with a system. So that way, students know when they had to, return to class. And then the other example I want to share is at Hollywood High School, which has a wellness center. And it's one of the historic, old high schools in Los Angeles. The behavioral health agency that is located on the high school campus of Hollywood High, what they do is when they receive referrals from teachers and counselors for students to get mental health services, the protocol was that the student's schedule would be stapled to the referral form, because then when appointments are made for the student, the mental health counselors would know, okay, let's try to take this student out of this class versus that class. And the counselor might put a note on there. Again, that's to really help reduce this disruption, maybe take a student out of a class that maybe is in the core or what have you. And so again, like Amy said, really establishing that collaborative system of ensuring that students are able to access services with minimal disruption to their academic program, and also just to the flow of campus. But thanks, Amy.
Sure. And just to add to that, what I've seen is that every school handles this different, and the systems that they can't come up with are all kind of unique to them. Some like to do slips, and some like to do phone calls, and some like to do other things, and having, the grace period. But that's why the having these conversations are so helpful, because it really helps sort of, bring up the things that are the most challenging and finding a good solution. And that really reduces a lot of tension that can come, and also just disruption for students. So this second example is another one of our, integration principles, which is about establishing collaborative systems and structures to plan programs and direct resources to at-risk students and their families. So, this one of the key parts of a smoothly functioning system of referrals is having some team that is coordinated to do referrals and sort of manage that. And so if a school doesn't have that, often that's a really important place for the administration and the school-based health center staff to come together to jointly figure out what is that system of collaboration and referral. What's that going to look like? So one of the models, and I'm not sure how familiar this is in the Inland Empire, if you use that COST acronym, Coordination of Services Team, but it's just a model of a multidisciplinary team of school staff and service providers who meet regularly to review the needs of individual students and the school overall. They collaborate on the linking of services, ensuring that kids aren't falling through the cracks, that they're being linked to the interventions that are most helpful, both through the school-based health center or other service providers on campus. And so this is a really, really helpful system on campus that is in some schools very well established, in other schools is non-existent, and in others might be somewhere in the middle there. But having some kind of system in place is really a integral part of this integration, and having school-based health center folks at the table. And so here, the sample process is really that there is a COST protocol in place, which includes a universal screening, meaning that anyone on the school campus can make a referral, including a self-referral from a student, but that can be, any school staff, a parent, and that there is a system in place for that to ensure that that referral gets to the right place. And really the anticipated outcome being that students are identified early, that there's improved academic health and social outcomes for students. I'm trying not to use that risk term that's in these slides, but students that have the high needs that are identified. So this is really a process that helps integration and that really supports a smooth flow between the school and the school-based health center. There's some examples that we'll share so that can be included in that live binder that you all have, that really lays out these principles again. And if there's a rubric that shows kind of emerging, developing, thriving, so you can sort of see where you might be landing in these integration principles, as well as some samples similar to these of like how we actually operationalize these principles into the work of the school-based health center. So go ahead to the next slide, Zane. So many school-based health centers have benefited from conducting a brief integration assessment, so a self-assessment, in order to determine where their program strengths lie and what are areas that might need attention. So I'm sharing this tool with you. It's a validated tool that really helps to measure and provide a scale for assessing successful integration. And these are the 5 domains: staff collaboration, integrated programming, marketing and recruitment, health authority, and shared outcomes. And really, this is not just helpful for existing school-based health center sites, but it also can be a really helpful tool for new sites that can assist them in planning and thinking about the systems that you're going to ensure are part of your program. This can be done, by individual members of the team and come together and share how the assessment, varied for different people, and also can just highlight the strengths of the program, highlight some of the gaps that you want to put some attention to. Is there anything you wanted to add, Sam?
I do. You read my mind. So this tool is so near and dear to me because it's actually one of the projects I worked on when I was at the LA Trust. It was a 2-year research project that we actually partnered with UCLA Pediatrics Department, because the idea was, we always say, oh, you have to integrate, your wellness center needs to be integrated. Are you integrated? And we would just kind of ask that, and people would be like, yes. But then we really thought about that and said, well, what does it mean to be integrated, and how do you measure that? how do you measure like how integrated you are, with your school partners, your community partners, or just that, the intersection of school and community partners. And so our UCLA folks really came together and combed the literature, and we put together an advisory group of experts on school-based healthcare around Southern California. And we engage in what we call like a modified Delphi process, which it's a little bit nerdy, but it's just this idea of like, okay, let's look at like 50 different constructs on integration, and really let's figure out what are the most salient and what are the ones that it's actually being used in the field to measure integration. And so, after several months of conversations and looking at the literature and really just doing a lot of key informant interviews, we came up with a really beautiful tool of, I think, 12 or 13 measures. And we have a QR code later, so that way you all can have it, but we'll make sure to include that in the live binder as well. But again, the idea is, like Amy said, it's a validated tool that's been tested. And in fact, what I did include in here is we actually were able to publish the results in a peer-reviewed journal, I think the Journal of School Health. And so we can certainly put that article in there too, for those who, like me, like to go back to the literature and kind of, gain that foundational understanding of like what this tool is about and how to measure it and all that. In LA, for a number of years after this tool became available, what we would have with the wellness coordinating councils, which are basically like the planning committees for all the wellness centers in LAUSD, we would, when those coordinating councils would meet, we would have the group actually either individually or do it as a group, but they would actually go through the integration tool and score themselves. And then, you get this rubric, score. And we would do that at the beginning of the year, and we would do that at the end of the year, just to kind of measure, did our level of integration improve? And if so, which areas? And, there are the 5 areas Amy's going to go through. There's a lot going on. And so maybe for this school year, we're going to really work on marketing and recruitment, because we're up and running, we're new, the word hasn't gone out yet. So let's actually focus on marketing recruitment. And then of course, the different strategies around that, you can really hone in on it. But, we really encourage you to think about how to use this tool. Sites that have been around for a long time use this tool, even every year, because again, it really allows you to measure how you're doing. And we also do it because there are new partners, right? Like some sites are really lucky to have long time partners, but as health centers evolve, as new needs emerge, and really perhaps even new school, and many times school district staff turnover, with new people, you want to really, again, kind of do a reset and say, okay, this is what it means for us to be integrated. Yeah, thanks, Amy, for letting me chime in. Should I go to the next slide?
Yes, thank you. So just to give you a taste of this assessment tool, this is one of the domain areas, marketing and recruitment. And these are the 4 kind of questions that we assess. And these are, about outreach. So the first one is about the school-based health center conducts active outreach in the school and community to inform students about the services it provides. The second one is about the outreach to the school staff about the services it provides. The third is about families and engagement with families and outreach. And the fourth one is about successfully enrolling students in services who are identified in school population screens. And so in thinking about these 4 domains, I thought we could just do a little interactive exercise. So what I'm going to ask you to do is use the Zoom annotation feature, which if you go to the top of your screen where it says view options, you click down to where it says annotate, and then it's going to give you a little toolbar at the top. And there's a option called stamp, and you see that there's just some little shapes, a star, a heart, a check mark, an X. And so as you think about your project, either if you are, have a school-based health center already, or if you're in the planning phase around that, and think about these 4, areas around marketing and recruitment. If there's one that you feel like, yeah, we have a pretty good idea of how to do this and what we're doing, and we've thought about this or we're doing it, put like a star or a heart next to that one. And if there is, one of these that you're like, wow, we really have not thought about that at all, we don't have a plan yet, we probably should spend some time, maybe put the X there. So just so we can get a sense of like who's thought about these where you might, at this place in your development, I know many of you are still in the thinking about stages. What are the pieces of this that you feel like you might already be doing or thinking about well, and then areas maybe where you haven't spent any time thinking? So I'll give you a few seconds to put stars or X's or hearts. Okay, great. I see folks are adding, in particular on the third one around outreach to family. So that's really great to see. Yeah, and maybe not as much confidence or experience yet thinking about or actively thinking about how you're letting students know about the services. Great. Yeah, so really the idea here is just to do your own kind of self-assessment, thinking through the areas that you want to make sure you highlight or place some attention on. And again, this is a great place where people can share ideas, because with outreach, there's all sorts of creative ways that people are doing this work. And so I encourage you as a coalition, as you're diving more deeply into this, to share with one another your different plans. So it looks like we've got stars and hearts on all four of these areas, and then definitely some places where people want to put some more attention. Great, thank you for interacting with me on that. Saying if you want to just erase those and then we can go to the next slide. Great. Yeah, you can.
Sorry, I'm trying to figure, okay, so clear and then click the next slide.
Clear and then go to the next slide, yeah.
It won't let me.
It won't let you?
Okay, let me close this, okay. Oh, there it goes, okay.
Okay, integrated programming. So this is another one of those 5 domains that's on the integration checklist or integration tool. And this is really talking about the ways in which your program has thought through some of the processes between the school and the school-based health center. So this example here is that you have a specific protocol existing. This is wellness center, but school-based health center, whatever you're calling yourself, to refer students for academic support. Because sometimes in the course of providing the behavioral health services or the medical services, it's uncovered that there's actually an academic need that we want to make sure gets shared with the school. And so is there a process for that to happen? And then the second one refers to kind of the opposite, like, is there a specific protocol that exists to ensure that the school can refer easily students to the health center? So kind of like what I was talking about earlier around the principle of cross teams or some kind of collaborative team. And then the final one is about like what might be happening, what is the school-based health center doing in terms of school-wide health campaigns that really involve the whole school, not just those folks that might be getting served in the health center. So if you want to do the same thing, bring up your annotation tool from view options and use your stamp feature to just stamp if this is something that you've thought about and you guys have a plan. You can put a star, a heart. If it's something that you're like, oh no, we haven't thought about this at all, we want to think about it. So go ahead and take a moment to thanks to all of you for using our Zoom tools. Great. Okay, well, I think you get the idea. So here we have, it looks like definitely folks have thought about the referral processes for getting academic support when that becomes identified in the health center. But maybe there's some sites that are recognizing that there really is no specific protocol yet that exists for the school to refer students to the health center. So that would be a really important, place to start to ensure that that's in place. And yeah, some wellness campaigns, folks have thought about that or have tried it out. So that's awesome. On the actual tool, you use different categories. It's never, sometimes, often, frequently, and always, but we just thought I'd use the stamps for this exercise. So you can go to the next slide, saying. So this is what the integration tool looks like. Here is the QR code if you're interested right now in downloading it. But as Sang said, it will be part of the live binder. So you will have access to this, as soon as we're done here. But at this moment, we wanted to stop and just do a brief breakout group, just thinking about what I've presented so far. And we're going to put you in groups of about 4 to 5, I believe, and really just spending a few minutes to talk about what is or might be your school-based health center's approach to integration in this domain of marketing and outreach. So that one that we first started talking about, marketing to students, to staff, to families, and just in your smaller groups have an opportunity to just share more about that. So we'll put that in the chat, and if there's more time and you're done talking about that, you can certainly go on to integrated programming, but I'm sure that there's probably a lot to say just about the marketing and outreach.
Right. So while everybody's coming back from their rooms, if one or two of you would like to share what was discussed in your breakout session, you can go ahead and unmute yourself and share with the group, or add it to the chat. Are we getting everybody in here? Oh, perfect. So anyone want to share what they discussed? What is or might be your school-based health center approach to integration in the domain of marketing and outreach?
I don't mind speaking up. We introduced each other and then we got out of the breakout session. So we all met each other and said where we worked. I mean, that's really honest. It was great. We talked to each other. That's what we did.
Thank you, Cami. I appreciate it.
I think, I'll go next. It was only 2 of us, but I think that what we were learning is that I'm currently a BHC supervisor for one of our county schools in the high desert. And even beginning this concept on that campus, the need is there. It's just, how do we implement? How do we start? How do we advocate for our families? Because again, I think that a lot of the general consensus is that having that one particular wellness center embedded into our community or our campuses up here, I don't think it's, if it does exist, I don't even know where to start or how to even, allocate those services. So I was just sharing that at our campus. I mean, the need is great. A lot of our kids at that particular county school have already been marginalized, and the difficulty there is, again, how do we become that conduit between the clients that we serve and their families, and again the resources that exist, and then bringing them obviously to our campus.
Thank you for your comment, Alex. Can you please add your email to the message box, and we'll have one
Absolutely.
of our community health system specialists connect with you and provide you more support.
Perfect. Thank you. I appreciate that.
Mara, do you want me to continue on?
Yeah, it looks like, I think in the group chat, Danielle mentioned that, the group that she was with, folks were new to the work. So they're just really learning about school-based health centers and they're not sure what it looks like yet. So that was the only thing that was added in the group chat. But yeah, whenever you're ready, you're free to go.
Yeah, and hi, Cami, I'm glad you're on here because I know you came to our last coalition meeting, but this space, is great in that it provides a chance for you all to connect with each other too, which is, talking about engagement and partnerships. Okay, I'm gonna go back and screen share and continue on. Hopefully I can, oh, no, I thought, let's see right here. Okay, back to screen share. Okay. Yeah, so the next section is really thinking about how we engage with parents and family. And I was looking at the comments when you're all in breakout rooms, and I think it was Bernadette Beltran who wrote that, parents really trust schools. And that is really the truth, right? Because when we talk about schools and the value of schools in school-based healthcare, we say, where else in our communities do parents drop off their 6 and 7-year-olds for like 5 or 6 hours and then come back and get them, and that's really schools, because schools are considered, trusted space, and parents really trust that. And so thank you, Bernadette, for really, sharing that, because this is what this section is about. So we want to go over 4 strategies, and I'm going to try to go through this section a little bit faster because we've got the community section as well, but really thinking about how to engage parents in the planning process, as well as when you actually have your school-based health center, how to really bring them into the fold. And so the 4 areas are really providing parenting support. Communication is huge, as I'm sure you all know. Providing a variety of volunteer opportunities. Parents, who can and have the time want to support schools, but what does that look like, right? And so this is a great way to really get parents involved, is, through your school-based health center, or at least the planning of it. And then really encouraging parents to be part of the decision-making at school. In fact, before I forget, I want to say that last one, Culver City, has a high school, and they're in LA County. They were also, they established their school-based health center, like I think in the 90s. And, it's I wouldn't say affluent, but probably like a real solid middle class, area there. They actually established a parent group that actually holds fundraisers every year to support their school-based health center. It's a really active parent group. And when we learned about that, we were like, wow, how fortunate to have a school-based health center where you actually have a parent group that's specifically designed to fundraise and to ensure that the school-based health center is really sustainable, because they saw the value of having a school-based health center at their children's campus. So in this first one here, I'm thinking about sorry, I can't see this. Parents, yeah, in providing parental support. This is, offering or to collaborate, offer or collaborate with community organizations to provide parent education classes, and also health workshops, for parents and teachers. And I want to share really quick that Locke Early Education Center, which is, I think, it's in South LA. The Early Ed Center itself is literally like across the street from the high school, the Locke High School campus. And so when they went about planning for their wellness center, they decided that there was more space at the Early Ed Center. So they actually placed the wellness center there. But in the planning of that, they decided, you know what, parents are so critical in early education, and how do we really get them involved? And so as part of their planning, they decided to actually build a studio right above the wellness center, and they made it, the studios for to hold like dance classes, yoga, things like that. It was a beautiful room with mirrors all around it, and that was really intentional because they decided that as part of their outreach to parents and to really serve the broader community, because the wellness center served the community, they were going to offer regular yoga classes and other exercise classes, and that was one way to really not only get parents involved, but to serve the parents who are in the community. And so, they had the space available, but again, thinking this through, when you're in the planning stages is really helpful in thinking about what you can offer and if you have the space to do so. The next bullet is around establishing a parent resource center that's focused on child, adolescent health and other important family issues. Many schools have parent resource centers, and for some of the ones that I worked with in Los Angeles, they were like, they made sure that the wellness centers and the parent centers were nearby each other. There was elementary school that where parents would, help with, the food pantry and the clothing closet and what have you. And that was all connected to the wellness center because that particular site really focused on basic needs and did a lot of referrals for those things. And so, again, just, being able to offer support to parents in that way. Hold school-sponsored health-related activities. I think Amy went through this a little bit earlier about doing screenings and really, being able to get, the parents involved in that. The next strategy is on communicating with parents and family. And here on the left side, I just listed, a number of communication methods. Some of these are maybe more feasible than others. And I bet a lot of you are already doing this, right? For everything from memos to flyers to, newsletters and what have you. But really just being able to find diverse strategies to communicate with parents and being able to do so, perhaps, in more than one language is helpful for some of our communities. And then, providing open lines of communication to receive comments and suggestions from parents. I know maybe a box with comments, isn't like, it is more passive, but really, how do you, ensure that the parents' voices are heard? Appointing a school staff or a clinic staff to be the point of contact for parents in the school. I think some of you are probably already doing this, that we found that to be helpful. And then providing information to parents when students are given health screenings. And, like, what is it that we're doing? How are we doing it? What's the follow-up? Some of the schools, who are doing, BMI screening or what have you, are they able to really put that in? In fact, I was going to say at Fremont High School, they did a whole campaign on healthy eating and active living. I think actually that was the name of the campaign, HEAL. And they use FitnessGram scores, which I don't think FitnessGram is continuing anymore in the state of California, but when FitnessGram, assessments were being done, they would, the school-based health center would actually, be shared the results of those, and they look at students who perhaps failed the FitnessGram, and then they would then, invite those students to come to the school-based health center to really get counseling on nutrition and physical activity. And at those appointments, parents would be invited, because sometimes we talk about, we'll say, oh, you've got to eat healthier. Well, to a 13-year-old who isn't buying groceries, it's hard to do that. And so that's one way to really involve parents in the health of their children. The third strategy is providing a variety of volunteer opportunities. I touched on this a little bit, but encouraging parents to serve as mentors, and other roles, for school health activities is one way to get them involved. For those who maybe have the time and the energy and the skill sets, you can involve parents in helping to write health related grants for the school. They, depending on, who you're able to get involved, they can come with personal skill sets that the school staff does have, but maybe not necessarily have the time to do so. And then really thinking about our parents with students with special healthcare needs, whether it's asthma or diabetes, asking them to share their expertise and their experience in staff meetings or professional development events. What does this look like for my child, and how can the school help? With that. I think I might have mentioned this at a previous webinar, but we did, some of our partners at another high school, Fremont High School in South LA, they did a whole asthma campaign. And so what the students decided to do was they would actually put up different flag colors depending on the air quality for the area that day, and that really helped students, not only be aware of what is a quality of air quality, but also whether that was a day to maybe spend perhaps less time outdoors or more time outdoors, and that was shared with parents, and for parents who maybe have kids with asthma, that was incredibly helpful to think about the fact that schools and the school health center and students really do care about these potential exposures to their children's health. And then the last strategy around encouraging parents with parent engagement is to really encourage parents to be part of the decision-making at school. One great way for those of you who are already involved in the planning process is to actually invite parents to be part of the planning or the advisory committees. What this may look like is maybe not having your planning committees during the regular school hours. Maybe it's like after school or early evening, if parents are working. And so really being able to accommodate, parents and other family members who want to be part of your planning or your advisory committee meetings. Enlisting parents in conducting needs assessments. There's many ways to do needs assessments, whether it's through surveys or key informants or focus group, but maybe having a specific focus group for parents. So that way they can really articulate, what they're seeing at home and how that may impact, the health of their children when they're at school. And then also enlisting parents in helping to identify school and safety priorities. So these are just some of the ways in which you can engage your parents, students' parents, and family members. I'm just doing a quick time check. Mara, is it okay if I go through the community partners and then we'll just do the combined breakout?
Yeah, that works.
Okay, yeah, because I know we have a few other things at the end there. So this section here on engaging community partners, I really, this is an area that's really, key for us at the Alliance, because we recognize, and we've been saying this throughout the webinar, that so much of the work in school-based healthcare is around bringing partners to the table, and what does that look like? And so here I want to just share a number of strategies around, connecting and engaging with your community partners. And before I do this, I want to say community partners can come in many forms. It could be county public health, county behavioral health, community-based agencies, religious institutions, nonprofit organizations, local elected officials, offices, what have you, mental health agencies, just a wide range of agencies that really do want to come to campus, and have presence on campus to really support the work of school-based healthcare, whether it's through direct services or through planning or through supporting, in other ways. And so I'll just go through these 9 areas and share some examples. The first one is creating a shared vision. What does our school-based health center look like, and what is the goal of this? Why do we want to do this? So I think having that shared vision is really helpful in being able to make sure that, everyone is on the same page. Identifying and focusing on common outcomes. I think this one it has room for lots of different opportunities. I'll just share an example, and that is that a number of years ago, and I probably won't mention the name of the high school, but it's also in Los Angeles, South LA. There was actually a breakout of chlamydia infection in the community. And, chlamydia infection, I think it's like, I don't know, 2% maybe, that is sort of like the prevalence. But at that point, I think it was like approaching 9 or 10% in the community. And so what the county health department decided to do was we've got to, get a hold of this, because infection, it spreads easily. And so what they were able to do is the county health department partnered with the school, where they brought in health educators from the county and delivered 1-hour workshops at all of the physical education classes around, chlamydia awareness and other STDs, and really a lot of prevention issues. And as part of that workshop, all students were given a paper bag with a urine cup. So that way they can, provide a urine sample. So that way all urine samples can be tested for chlamydia. And for students who, wanted to opt out for whatever reason, or they weren't sexually active or what have you, they could do that without, it being stigmatized. So everyone would still go to the restroom and go through the stalls, but, just return an empty cup, and nobody would know that they didn't participate. That, I love talking about that project, because it was such a beautiful example of the response that the school-based health center, the school, and the county came together to tackle a real problem, in the community around curbing, chlamydia infection rates. And for those who tested positive, they were able to get, treatment along with their partner treatments. And, again, that's thinking about a common outcome, right? Which is identifying the positive cases and really giving students the treatment that they need to prevent further infection. The third one is around clarifying roles and responsibilities. And this is, what is the responsibility for the school versus the clinic versus the staff? And this could be things like who's responsible for repairs when maybe there's plumbing issues at the clinic. Is it the school or is it the clinic? The community health partner, let's say an FQHC or what have you. Waste removal, who's responsible for that? Who's responsible for ensuring that consent forms get sent out and are returned and signatures are verified? And so really being able to clarify roles and responsibilities will really help with the engagement with community partners. The fourth one is around clarifying decision-making, which is related to roles and responsibilities. And this is really thinking about when and who gets involved and who makes a final determination. Does it fall always under, the school administrator, or is this, a joint decision-making when there's a, clinical issue at hand with, or in terms of operations, not the clinical services, but the clinical operations? Does that belong to perhaps the partners, who are on campus providing services? The next one is aligning services with needs. And, when we were talking about this one earlier, I thought, well, that seems kind of like duh. But again, this is really thinking about what are the needs of the community and are we providing that? If a particular agency is coming and providing, I'm just going to use a dumb example, like, I don't know, chiropractic services, is that really the need, of the students and their families, or are they much more in need of perhaps oral health services? I know Bonnie's on this webinar. Do students really need to get screened and really get attention on their oral health? And so again, thinking about, do services align with the needs? The next one is build on existing assets or seek out additional partners. If the school-based health center is doing a campaign, let's go back to the chlamydia, example, is that a way to get the health class involved or the health teachers? Or do we want to do a campaign to promote, maybe food security, but maybe the partner doesn't have as much experience. So maybe this is where we bring in other partners, the local food bank, to help us think about what is this appropriate screening for this, and could we set up a farmers market one day a week to really be able to provide the services that we need. The next one is around developing MOUs. We really encourage this because this helps to solidify partnerships and also really helps us understand, what people are committed to doing and making sure that, there's follow-up, and really just, again, formalizing a partnership is always good, right? Because then not only does that help to strengthen the relationship, but there's a certain level of accountability there. And we have, in our resource directory, a number of sample MOUs for sites that are starting out and wanting to partner with community-based organizations. What should that MOU look like and what needs to be included? The next thing is really thinking about how to build evaluation into your program. This could be big and small. It could be things like making sure that you have patient satisfaction surveys. How was the service provided? Do the hours meet the needs of students and their families? But also longer term, bigger evaluation. I know at LUSD, with the support of the LA Trust, who I used to work with or work for, we're definitely looking at the impact of behavioral health services on students' attendance and also academic progress. And so we're able to do what we call like a dose response relationship analysis, where, okay, if a student gets seen, 12 sessions this year, did that really impact perhaps a better attendance record than the year before when they weren't receiving mental health services? Or, did their overall GPA go up? Of course, it's not causation or correlation, but I think just being able to really help evaluate the presence of school-based health services and its impact on, I think, our academic progress is really key. And we know that is the tune that is aligned with schools and school districts. And so, how does the partner, how can a school-based health center really think about that? While we're on evaluation, I forgot to mention earlier that I forgot to mention another example around a shared vision, and that is between 2015 and 2020, the LA County Department of Public Health actually worked with the community to come up with their CHIP, which some of you know, it's the Community Health Improvement Plan. And in there, which I'm still really like amazed at, the county, plan actually had the idea of supporting 100% graduation rate is as one of their objectives. And I just thought, wow, what is a health department doing talking about 100% graduation rate? It was clear that, they recognize that graduating from high school is one of the indicators, or not indicators, but is one of the factors that really help address, cycles of poverty and things like that. And so, talk about having a shared vision, right? It's coming not only from LA Unified School District, who's responsible for the education of our students, but also that the county health department wanted to make sure that that was also included in their community health improvement plan, to say, you know what, this absolutely impacts the health of our population, and we want to support, the district's objectives around that. The last one is around creating a sustainability plan. We could do a whole webinar on what sustainability looks like, but I think the key part here to share with all of you is that if you're in the process of planning your school-based health center, it's never too early to start talking about sustainability. How do we keep operations going? What does it look like 3 years from now, 5 years from now? And we have, spreadsheets with formulas in there that you can plug in and think about, okay, if it costs this, $100,000, whatever the amount is to operate the site, what kinds of financial planning do we need to do to ensure that, the school-based health center stays open? And so really, from the school side and the community partner side to really think about a sustainability approach and having a plan in place for that. Okay, welcome back, everybody. It's a good sign when you're all taking your time coming back, because that probably means you're engaged in conversations with each other. Maybe we'll spend like 1 or 2 minutes just to see if anybody wants to share what they were able to discuss in your groups. Anyone?
In our group, I'm sorry. Hi, I'm Sylvia. In our group, it was good to hear that we have resources with public health, and so she's going to connect us to the health education, because we're still working on building this. And I see Cecilia is trying to speak, so I'll let her jump in. Thank you.
Thank you, Sylvia.
Oh my gosh, I was just going to say it was a brief time again, but I think both of the people that were in my group, which work in schools, they're in the exploring and deciding whether or how to do it. So they're really at the early stages. So they're anxious to either, connect with others that are on this call. And I definitely thought, saying you would be a good connector, but also the recording and the slides, they would really like it and benefit, because they can kind of absorb it a little bit more after, kind of hearing it for the first time. Getting another chance to hear it and review it would be great. But I think the networking is important for the people I met. Yeah,
thank you, Cecilia. We'll have to maybe nudge tomorrow to give you all a little bit more time next time, or to get me to stop talking so you can all have a chance to engage with each other. I think there's somebody in the chat. Okay, yeah, I was gonna say, so I won't read out the chats because you all can read it for yourselves. But yeah, I want to say, in the 15+ years I've been doing this work, I have to really highlight the role of health educators. I know lots of organizations employ them, county health departments, behavioral health, nonprofits, and Amy can probably attest to this, but some of our really stellar school-based health centers really deeply invest in health education, and actually hire health educators to do a lot of this work. Some of it coordination, but a lot of it is doing workshops and engaging parents and working with communities, and really so I can't stress enough, like if you were going to figure out, okay, which positions should we really prioritize in funding, I would really vouch for that. And it's not because I come from a public health background, maybe a little bit of that, but really just in the work that we're seeing. And so I just want to mention that. Amy, I don't know if you want to say anything about that while I pull up the slides to finish up.
Well, I actually was wondering, I thought I saw Cecilia Gutierrez was trying to speak. Go ahead and unmute yourself now.
Okay, sorry. We actually did discuss, I had chosen one of the 9 strategies, the aligning services with needs. In my high school, I work at Rialto Unified School District at Eisenhower High School. We actually have a request for assistance form that we fill out whenever we have to refer a student to the wellness center. And we do have this system in place where we have students that have been on 5150 holds and they're re-entering back into the school. So we get together as a team. We have the wellness counselor there, an admin, and also a psychologist, and we do follow-up check-ins with the students. So we meet with the parent, the student, and basically assign people that they're comfortable with at our school site to be able to check in so that we can make progress with them as far as their well-being. But that's the system we kind of have because there is such a high need here, behavioral health and mental health in the high school setting. I think that part we do have pretty good because we have a system in place for referral process and follow-up also. So I get involved with the crisis team and I participate as the school nurse. I usually see a lot of these students that are having certain health issues or anxiety, depression. But yeah, it's just kind of interesting to see the different areas of different people in the group of different locals, you know, and different counties and everything, that just the different planning phases. So right now we have wellness, okay, but like there would be more opportunities to provide more health education would be wonderful. Just getting the word out there. I know our school has like a social media page where a lot of the parents go on, and then they do town hall meetings also. So that's all I wanted to add.
Thanks. Cecilia, I'm so glad to hear about your re-entry for students that have been 5150. I think that's really great. That's definitely an area that I encourage folks to think about. It also, I've seen schools that do the same for students that have been in the juvenile justice system and then are re-entering, or foster youth who are sort of moving from school to school a lot, just really having a way that those young people are identified and held a little bit more closely. So thanks for sharing that. So we're getting to our last few minutes with you, but we did want to take a moment to just plug our conference that the California School-Based Health Alliance offers every year. Actually, last year it was in the Inland Empire in last April in Redlands. This year it's going to be in Sacramento in April. It's a 2-day conference. The first day is workshops. We have lots of really amazing folks and experts in school-based health coming to present and share and network and inspire. And then on the second day, which, you know, not everyone comes to both days. Some folks just come for the first day, but the second day is an advocacy day. Since we'll be in Sacramento, we'll be able to go to talk with legislators, talk about the importance of school-based health, share with our local representatives what's happening on the ground. So it's really on their radar what can support schools. So if you are interested, please go to our website where you can find out more information. And just to say that we do have a lot of scholarships available. So if registration cost is an issue, don't let that be a deterrent. We want to make sure that people that want to go can go. So lots of opportunities there. Feel free to reach out. And I'll pass it back.
Yeah, thank you, Amy. So the last thing we want to say, and we've got like a minute left, is that our Inland Empire School Health Coalition is continuing to go strong. We actually have our next meeting on February 9th. And Cecilia Gutierrez, I'm so excited that you're from Rialto because we're actually going to your site. So we've been working with
Yes, I just got the email for it.
Yeah. And so we're so excited to go there because we do try to rotate meeting spaces because we want to tour as many school-based health centers in the region as possible. And we're looking forward to being at your site and really seeing what all the great work you're doing there. I'm going to go ahead and drop the registration link in the chat box, because when these slides were done, we didn't have the location yet. So there it is. And we, it's a wonderful convening 3 hours that goes by super fast as well. And we've always provide lunch, but most importantly, we provide a space for you all to connect and learn from each other. We have our contact information here, but I want to take this moment to thank everyone for being with us this afternoon and turn it back to Mara for the last 20 seconds.
Okay, hi, everybody. Okay, well, we just want to thank you to all our partners that joined today, and we hope that you're leaving with great information. We're going to go ahead and send out a follow-up meeting with slides, recording, and resources that were shared today in the webinar. But also, I want to remind you, we are three community health system specialists too, that we our target is to support all the districts, all the 33 districts. So when you get this email with all the material, please respond if you want to connect with one of us, and one of us will, depending on your area, we'll definitely connect with you and provide more support. So remember, we're also going to send out a survey, and your feedback is much appreciative, because that's how we can provide more effective webinars. So our next webinar will be held virtually on the 14th of March, and it's going to focus on student-centered design of school-based health service. So a flyer is going to be sent out soon. Please be on the lookout for that, and it's going to have a registration link. So have a wonderful rest of your day, and thank you again for partnering with us. Thank you.